My name is Mochon. I'm a cardiologist at Reading Hospital, Tower Health, and I'm a program director for Cardiovascular Fellowship Program.
Hello, my name is Dr. Gregory Wilson, and I am a cardiologist at Tower Health, and fortunate enough to be the assistant program director of the Cardiovascular Fellowship at Reading Hospital.
The Reading Hospital Cardiovascular Disease Program has been approved for 6 positions a year. The goal of our program is for the graduates to be excellent clinicians, but also lifelong researchers, great teachers, and experts in the procedural techniques, and fully functioning, competent cardiologists.
Certainly, we want to make sure that our content covers all the necessary requirements for a program as spelled out by the ACGME and other documents. So it fulfills all the necessary requirements for board eligibility. But I think we also offer a little more than that. We have unique opportunities for research with a partnership with Drexel College of Medicine, and we have some fantastic teachers with a lot of hands-on experience that I think our trainees are going to get from day one.
We built a very extensive curriculum which include multiple rotations like cardiology consult service, cardiovascular ICU, echocardiography, non-invasive testing, cardiac catheterization lab. Fellows will also have experience in electrophysiology, vascular medicine, congenital heart disease, as well as advanced heart failure. With that, they will have ability to work and gain a lot of competency with the non-invasive testing like echocardiography, nuclear cardiology, CT, and cardiac MRI, as well as perform multiple cardiovascular procedure like cardiac catheterization, pacemaker evaluation, and defibrillators evaluation, and transesophageal echocardiograms.
We're fortunate that we have a lot of good leadership that has brought a lot of interesting technologies at the forefront of cardiovascular care to our area, so they're going to have hands-on with front-of-the-line, top-of-the-line, state-of-the-art cardiac procedures from the very beginning, their first month.
In 2019, we had nearly 2,000 diagnostic cardiac catheterizations and almost 1,000 coronary interventions. We average about 100 TAVR procedures a year, and this volume is growing.
You're going to have a fantastic educational experience. We're fortunate that we have, I think, a very unique place in the community, that we're a large institution that has a lot of breadth in terms of pathology and cardiac conditions that we treat, while at the same time a high volume, but in a community setting. And so we keep that community feel, we keep that family feel that I think makes it a wonderful place to work, wonderful place to learn. So I think even from day one, you're going to get that, where you're not treated necessarily as a trainee, you're treated as a junior colleague and as a partner in this process. We are all physicians, we're just different levels of our experience in that journey, and so you're viewed as that from the very beginning.
Fellow will be encouraged to practice according to the level of training. As we see fellow grow throughout the fellowship, we learn them more.
I think you can expect that the faculty is going to be dedicated to your learning, and I think you'll be surprised at how collegial they will be with the trainees. Again, they're not going to view them just as a trainee, they're going to view them as junior faculty and partners in that process. So it's a very collaborative approach. Let's learn this together. A lot of trust back and forth between the attendings and the trainees, the fellows from the beginning. And there's responsibility for the fellows also to be part of that teaching process. So they're going to be learning, but they're also going to be part of the teaching and educator process as well to the residents that we have at Reading. So I think that's going to be an important role as part of their education to be teachers.
Reading Hospital is the part of the Tower Health, which is the third largest healthcare system in the Philadelphia region. With that, fellows will have opportunity to be exposed or experience care of patients with multiple medical conditions.
Well, we are certainly a busy facility, and Reading, one of the things that always gets discussed is our emergency room. We remain one of the busiest emergency rooms, not only in the state of Pennsylvania, but in the country as well. So there's a lot of inflow and a lot of cardiac pathology just by nature. So the volume is certainly there.
Because of the nature of the medical problems that we take care of, we have close interactions with all the subspecialties in Reading Hospital. What I would expect from the fellow as a program director is to have the enthusiasm, the strong work ethics, and ability of being a team player.
You hear so much about physician burnout these days, and which is a true concern. Now more than ever, that needs to be addressed as part of and early in the career as part of the training process. And I think we definitely have taken a stance on that as part of our cardiovascular fellowship, where incorporated into the curriculum will be wellness, physician wellness, fellowship wellness. And so that gets addressed early, and so that we make sure we're healthy enough to treat our patients as practitioners. I think that does set us apart, certainly from other programs. Again, your mentors, your faculty will truly treat you as colleagues and want you to be healthy, want you to be happy. We want people to want to be here. We enjoy what we do. It shows in what we do. Our patients can sense that we enjoy what we do, and we certainly want to pass that on to our trainees.
Training in Reading Hospital will give you an unique opportunity to balancing clinical and academic experience, but also develop close relationships with your patients, faculty, and hopefully becoming part of community.